This time I'd like to call the meeting to order and welcome everyone to our interim session for the month of May in Morgantown. Welcome. This time the chair would call on the clerk for the taking of a silent roll for establishment of a quorum. The quorum being established, the chair looks at the vice chair for the purpose of a motion.
Thank you, Mr. Chairman. I move the minutes of the April 26, 2022 meeting.
Co-Chairman Woodrum moves the minutes of the April 26, 2022 meeting. All those in favor of the gentleman's motion, please signify by saying aye. Aye. Those opposed, nay. The ayes appear to have it. The ayes do have it. I declare the gentleman's motion adopted. Before us today is a discussion of child care funding and regulation, as we'd talked some in the regular session about it. So no further things being heard. I will call first to the podium Janie Cole, who is the Interim Commissioner of the Bureau of Family Assistance.
Good morning. You don't mind.
Ms. Cole, as is the custom of the legislature, we do need to swear you in. Do you swear or affirm testimony you're about to give is the truth, the whole truth, and nothing but the truth, so help you God?
I do.
State your name and position for the record, and the floor is yours.
My name is Janie Cole, and I'm the Interim Commissioner for the Bureau for Family Assistance in DHHR. So it's interesting that I'm here today to speak about this topic in this town. I began my childcare journey. Sit down. I'll sit down. I began my childcare journey just across the parking lot in the mid-90s at what was at the time Ruby Memorial Child Development Center. It's not there now. There's a beautiful children's hospital that's been built where that building was. But we were a NACI accredited center. You'll hear a little bit more about what that means. They did not take state child care subsidy. They did have scholarships for people, medical staff that had a financial need. So every month, this center barely made it in the black. For the most part, it operated in the red each month. Yep. And the hospital was a partnership with a national company that was operating this center. And the hospital was willing to invest in a center that was not making money because it was a recruitment tool for high quality physicians. So I say that not only for the coincidence, but the childcare crisis has existed in this country far before the pandemic. The pandemic exacerbated it and brought it to the front line. So you'll hear conversations about it, but it was there in the 90s. Parents could not afford what it costs to pay for high quality childcare even then. As brain development has evolved, we know the importance of investing in children, and that changed the game in the 80s and the 90s. So before I turn it over to our two experts from DHHR as well, I want to leave you with a word that is often used in tandem with childcare, and that's workforce. But when you talk about workforce and early childhood education, you're talking about it threefold. You have your childcare workforce. We have thousands of childcare providers in the state. Most of them are earning poverty level wages. For the most part, childcare providers get paid minimum wage. Almost never do you see them receiving benefits. They don't receive health care, yet they're exposed to illnesses on a regular basis because you're down on the floor with children. The second part of workforce is the parents, and that's the one most commonly spoken about, that we have childcare deserts, we have a need. There's a workforce issue with parents not being able to go to work because we don't have enough childcare. Parents need childcare to work and go to school, but they need safe, stable childcare so that they don't lose productivity at work worrying about their children and where they are. And the third piece of workforce with early childhood is the most important, and that's the children. They are our workforce of tomorrow. We know now that there is enough research out there that shows a link with high quality early childhood education and school success, work success, lower crime rates, higher salaries. It's all there. There's studies out there, one from the Heckman Institute. It's a return on investment study. And that's, the numbers have evolved in my career time. I think we are around, for every dollar invested, you save 13 over that child's life. So 1 to 13, that's the return on investment for high quality childcare. So I have with me two staff today. I have the director for the Division of Early Care and Education. She is also a former child care provider. She was a director in 2 separate centers before she was a trainer at the Child Care Resource and Referral Agencies, which you'll hear a little bit more about. And I also have Deidre Craythorne, who has been a part of our child care subsidy system since the early 90s in some form or another. So I will turn the formal presentation, with permission, over to Lisa and Dee, and I believe you all should have a copy of their PowerPoint.
If Lisa Ertl would come forward. And Deidre Craythorne. Okay. I do need to swear you both in.
Okay.
Do you swear and affirm that the testimony you're about to give is the truth, the whole truth, and nothing but the truth, so help you God?
I do. I do.
Please state your names and position for the record, and the floor is yours.
Okay. My name is Lisa.
And please have a seat.
My name is Lisa Ertl. I'm the director for the Division of Early Care and Education.
And I'm Deidre Craythorne. I'm the Child Care Program Manager for the Division of Early Care and Education.
Okay, floor is yours.
Okay, thank you. Janie Cole, our interim commissioner, mentioned us working in childcare. I got into childcare because I was a single mother with 2 small children, and I was substitute teaching for the Department of Education at the time, and summertime came around and I wasn't sure what I was supposed to do. I needed a job during the summer to support my 2 small children. And I ended up working for a NACI accredited program in Charleston for their summer program. And I liked it so much that I ended up staying in the child care field. It helped me as a mom, because at the time, if you worked at that center, you didn't have to pay for child care. So that was a big bonus for me as a single mother at the time. So ever since then, I have been in the child care field, and it's professional and it's personal for me. Personal because I was a consumer of child care then, and I have grandchildren, 2 grandchildren here in West Virginia that are consumers of child care now. So it's personal, but it's also professional for me. In front of you, you should have a presentation, and I'm going to talk just a little bit about kind of the history of the Division of Early Care and Education and Child Care Regulation in West Virginia. So in 1945 or 41, the code was revised to require child welfare agencies to be licensed. And in 1942, the first written standards were developed for child care and placement agency homes. So as far back as 1942, there were child care regulations in West Virginia. In 1969, the child care subsidy system began, wherein there were about 400 children served at a cost of under $300,000. And Dee will talk a little bit about what the cost is today and how many families and children are being served. In 1974 to 1976, a comprehensive training program was developed for child care centers. So even as far back as 1974, we talked about the importance of quality in child care programs and needing an educated workforce to care for these children. In 1988, the Family Support Act was implemented, which created the federal jobs program as part of a welfare reform package, and provided an entitlement program with funds to pay the child care costs of persons participating in the jobs program. And then in 1990, the Budget Reconciliation Act created both the Child Care Development Block Grant and the Title IV-A At-Risk Child Care Program. And the Child Care Development Block Grant is what we use today to help pay for child care subsidy. Of course, the percentiles of eligibility have changed over the years, but At that time, West Virginia's eligibility entry was set at 60% of the state median income, and the exit was 75%, with families paying over 40% of the fees. So that was back in 1990, and the child care subsidy program has evolved quite a bit since then. In 1993, the first 2 child care resource and referral agencies were piloted. And then in 1994, the number of child care resource and referral agencies expanded to a total of 6 across the state. And still today, we have those 6 child care resource and referrals providing not only child care subsidy eligibility support for families, but also professional development opportunities for the child care workforce. Because in the child care development block grant, there is an expectation of professional development of the early care and education, the child care workforce. In 2003, the Division of Early Care and Education was formally born. Prior to that, it fell under the Office of Social Services. The primary focus then was to support families that were in some type of training or working, and that support remains the same today, although the supports we provide to families through the child care resource and referral agencies and some of the other programs that the Division of Early Care and Education administers has grown. Of course, the Division of Early Care and Education promotes safety and well-being of children by enforcing child care regulations. The division encourages children's learning by enhancing the quality of early care and education and after-school programs for the children in West Virginia. Prior to 2014, the family child care providers still fell under the Division of Social Services, but in 2014, the family child care regulation components fell under the Division of Early Care and Education. So the specialists joined, the specialists that are monitoring family child care homes joined the Division of Early Care and Education. So we now have a division of 54 staff, with most of those being field staff that look after the child care regulation component within the field throughout the state. I mentioned that the child care development block grant has several requirements, and one of those requirements is promoting quality child care throughout the state, and the Division of Early Care has the Quality Initiatives Unit. They oversee the West Virginia Infant Toddler Specialist Network. They are a West Virginia Pre-K DHHR designee. They oversee the quality improvement specialist work that goes on via the child care resource and referral agencies to all the child care programs throughout the state. They oversee the quality rating and improvement system through their advisory council. And they also oversee the traveling resource and information library system, which is a statewide system. It's called TRAILS for short. It is a traveling mobile library of materials, resources, and equipment for child care providers to help offset the cost of care for children, whether it be in the home or a child care center. Within early care and education is also the child care subsidy unit. Of course, they oversee the child care subsidy assistance through policy, payment rates, payment practices, making sure that folks are in qualifying activities, a sliding fee scale, those types of things. They work on data system policy management, and they also work on a website to support consumers. It provides a lot of consumer education about child care in the state of West Virginia and how to access certain supports, how to understand what initiatives are available in the state of West Virginia, how to become a child care provider, you name it, it's on our consumer education website. So those are some of the roles within early care and education. Currently, as of February 2022, the most current data that we have available, the number of subsidy children served by the state is 16,777. 25.8% of eligible subsidy families are receiving subsidy. 5.1% of gross income goes towards copays. And if you remember, the copay was almost 50%, if not a little bit more, when it first started. So 5.1% of gross income towards copays. 30.2% of families are at or below the federal poverty level. 1.6% list TANF as their source of income. 58.3% of the families who access subsidy are a single parent household. 721 is the average cost of care per child, $721, and then 65.7% of total expenditures were for children under the age of 6. So that's a little bit of statistical information about child care subsidy. The Child Care Regulation Unit, they conduct rule enforcement for the 5 child care provider types, everything from out-of-school time programs to child care centers to family child care homes. They are out there in the field monitoring programs to ensure compliance with the child care regulations. They provide technical assistance of the child care regulations. They conduct complaint investigations. They also conduct targeted monitoring. As a result of the complaint investigations, we often see a common theme of non-compliance. For example, maybe there is an issue with child care supervision. We know that that's an issue, so we'll do some targeted monitoring and conduct unannounced visits just to observe what is happening in the program regarding supervision, for example. So that's what we're talking about when we talk about targeted monitoring. That unit works on drafting rules, makes recommendations on rules based upon federal requirements, industry standards, best practice. So there's a lot that goes into the regulations, and they also work on drafting policy and making recommendations for policy. We try to have a system that is user-friendly, but we don't always achieve that. So we work with our child care providers to determine what those barriers might be so we can move forward and have a more seamless, easy system for them as they apply to become child care providers and continue to become child care providers. Within your packet there, you'll see that there are currently 697 family child care homes, 150 family child care facilities, 309 child care centers, 87 Head Start centers that are required to be licensed, and 86 out of school time centers. So there's about almost 1,300 child care providers throughout the state. And then, without taking too much more of your time, we have the Child Care Resource and Referral Agencies. They are grantees of West Virginia DHHR, and they do a lot of the on-the-ground direct service work with child care providers and families that are accessing child care in the state. Parents will go to their local resource and referral agency to access child care subsidy assistance. They do provide the professional development training for providers on the subsidy system. They are the hub for linkages and referrals to other services parents might need. They can conduct, I'm losing the thought of what it's called, the ages and stages.
Developmental screenings.
The developmental screenings for families. They've been trained how to do that, and they do that for families as well. professional development opportunities for providers, to technical assistance for providers, behavioral consultation services for providers. It's never the hope or the desire of anyone that works in early care and education to kick out a child for their behaviors. A lot of behaviors are typical for the age that a child is, but we're also seeing a little bit of trauma based upon the issues that have come about because of the opioid epidemic, because of COVID and what has happened with COVID. These children have been stressed. So the behavior consultants are working with the child care providers on supporting most effectively each child that is experiencing these type of issues, so they aren't disenrolled from their child care program. Infant toddler professional development and technical assistance. We have a whole module-based training on infant toddler caregiving that caregivers that care for those ages within West Virginia are required to take to make them be able to demonstrate appropriate infant toddler care in West Virginia. And then, as I mentioned before, the traveling resource and information library system. And in your packet, I'm not going to go over these. There are the Division of Early Care and Education and early care and education as a whole in the state of West Virginia doesn't work in a silo, doesn't work in a bubble. We have always had a history of collaboration and partnership in the early care and education field, pulling the best minds and knowledge to each other to develop what's best for the children in West Virginia. So these are some of the partners that we work with. Right now, we're holding forums about the child care regulations and what possible barriers child care providers could be having with the regulations. So as we move forward, we can work together to fix that. But we even work with our child care providers and make sure that they give us input on what it is that they need, what they're seeing out there, because they're supplying those services directly to the parents. So those are the supports that you see there for early care and education. Other partners that we have: Help Me Grow, Birth to 3. We have the Early Child Advisory Council, which pulls in a lot of these partners, and we talk about what they're doing in their specific fields and what we can do together to best support the field of early care and education. Just talking a little bit about the Child Care and Development Fund. The Child Care Development Fund is the main source of federal funding provided to the state for child care services. The funds must be expended on programs that improve the availability, affordability, and quality of child care programs. And if you look at your handout there, you'll see what the total federal funding is. This is just for the Child Care Development Block Grant. It was back in, what was it, 1980 something, $300,000 supporting 400 children. It's now $54.3 million of federal funding, which includes $37.5 million in discretionary funding, 8.7 in mandatory funding, and 8.07 in matching funding. Eligibility is now, the entry level is 150% of the 2019 federal poverty level, and the exit is now set at 185. So you can see how over the past 25, 30 years, it has grown exponentially. And the number of families served is 21,257 and 5,056 children, or 5,056 families, I'm sorry. During the pandemic, at the onset of the pandemic, childcare nationwide benefited from the CARES Act. West Virginia specifically got a little bit over $23 million. That funding hit us about for 3 or 4 months into the pandemic, and we had it available. And what we did with that was provide some small grants to child care providers to help offset those new and expanded costs of personal protective equipment, sanitation supplies. I talked to one provider during that time. Their line item for their sanitation equipment during that time went up about $1,000 a month. So they were able to request funding for that through these funds for the CARES Act. The fund specific, and then we had the CCRRSA Act, which was $68 million. We also were able to provide grants once again for that personal protective equipment, those sanitation supplies, but we also didn't allow the federal government had guidelines that we had to fall within, and we were allowed to have child care providers utilize that funding for everything from helping to pay their mortgage or rents, helping to pay staff, maybe giving them a bonus or a temporary increase, helping to expand their programs. Maybe they had a classroom that they didn't use because they didn't have the materials and equipment. So they were able to use it to hire staff. They were able to use it to maybe open up another classroom, anything but those capital expenditures that they could use it on. So we used those funds for that. And then the ARP Act funding was $260 million. We're still providing grants for child care providers with this, but they're also getting a monthly child care quality bonus. And depending upon the type of child care provider they are, for example, a family child care home is receiving a check for $750 a month, and a NACI accredited Type 3 program, which is the largest program we have here in West Virginia, is receiving $27,000 a month to help offset the cost of child care. So it varies widely, but a Type 3 center, I'm trying to remember off the top of my head how many children that they can take.
That's up to 60, over 60.
Over 60. We have a lot of Type 3 programs that are NACI accredited that take 300 children. So that's a big program. So they are using it in various ways. They are giving their child care staff bonuses. They are, some of them now, offering health insurance with it, which is something that was unheard of just a couple of years ago. They are expanding their services to take in to expand their capacity to care for more children. Because what we found was the number of child care providers in West Virginia that were open prior to the pandemic, we have the same number that are open after the pandemic. However, it's not the child care centers that necessarily stayed open. We still have a few less child care centers, but family child care facilities, those smaller programs that can care for between 7 to 12 children, that has expanded. We have increased prior to the pandemic to now. We have about 22 more family child care facilities than we did prior to the pandemic. So we are seeing the number of providers pre and post pandemic remain the same, but the configuration of provider type looks different. And within all of these acts, all of this child care money that came in, we have been using it to pay for over income essentials that those families that don't qualify for traditional subsidy may qualify, depending upon if they're considered essential in the state of West Virginia, for child care assistance using these CARES Act funds. And we have also used these funds to increase the reimbursement rates for child care providers at least through September 2023. But there is conversation and work being done at the federal level that we will be getting an increase of block grant subsidy coming, and we will be able to permanently keep that rate increase. But they still have not confirmed with the states if that additional child care subsidy funding is going to be available. And Dee can talk about that a little bit more. But it increased tier 2 rates from an additional $2 to $3 a day. So there's that incentive. If you increase quality, you increase your bottom line by getting more subsidy funding. And tier 3 rate increases from $4 to $6, and that is per child per day. And tier 3 is a national accreditation. You can be nationally accredited if you are a family child care provider or if you are a child care center. And then $20 million in the form of startup and capacity building grants, which I had already talked about. Excuse me. So I kind of ran it all together, I'm sorry, but the stabilization fund initiatives, grants, quality payments, rate increases, enrollment versus attendance. Prior to the pandemic, the subsidy child care, a child had to attend for 13 days before a child care center or program, a family child care provider, would be paid for a full month for that child. But during the pandemic, using these stimulus funds, if that child attends one day, the child or the child care center will be reimbursed for that care for that child for the entire month. That really helps a child care provider's bottom line. They have some stable income. They know what's coming in. It's more reliable to know that if this child is here for 1 day or 30 days, I'm still going to get paid X amount of dollars because my business, whether that child is here or not, I still am paying staff. I still have to keep the lights on. You know, all of that still goes into it. So I've talked a lot. I'm sure you have some questions, and Dee and I are here I will primarily talk to you about child care regulation, and Dee will talk to you about any kind of subsidy questions that you have.
Okay, well, thank you for your presentation, and I'm sure we will have a number of questions. So with that being said, who has the first question? Delegate Chris. Oh, I'm sorry. You have to tap to the members. You have to tap the little brown thing in front of you to get it to turn green, and then the floor is yours.
Oh, thank you.
On your potential eligibility for families receiving subsidy at 25.8%, is that the penetration point?
Yeah.
Of eligible families, and you're only getting to 25% of the people? Is that correct?
That's correct.
Why are we so low?
Actually, we're one of the highest in the nation.
I don't care about anybody else. Why are we so low? Are we not getting the message out to these families? And what is it that we need to do, or you all need to do, to get that participation rate up?
It's part of the nature of West Virginia, I think, in that a lot of people use informal childcare settings. So if I know grandma's available, I'm going to use grandma and not take my child to the childcare center. I think it's just kith and kin care in West Virginia is pretty popular.
Okay. So are we tracking that also? Do we track any of that?
We do not track private pay or private arrangements on childcare, but we do charge our childcare resource and referral agencies with promoting their programs. And they go to community fairs and just to get the message out to let people know that childcare assistance is available.
Okay, thank you. The next question, on the CARES Act and the CCRRS monies, are those monies all expended?
Yes.
So you're out of those programs?
Yes.
Okay, and the ARPA money, of the 260 million, you talked about some expanding of current programs. So what happens when this money runs out? And are you going to ask us to participate in any subsidy match in these funds? Or are we going to be required to give up more state dollars to match these federal dollars?
I think that would be up to the leadership of the agency. I don't think anybody
Right.
here can answer that today.
We do know when that funding runs out, that funding, the ARC funding has to be spent by September of 2023.
Right.
When that funding does run out, there is going to be a hole. We're going to revert back to what our numbers were before regarding finances. But yes, it would be up to our leadership to do that ask of increased.
So how much of this 260 million is on an annual basis?
The 260 million
Yes.
is specifically for the stimulus funding. The 54 million is what we're getting on a regular basis for the Child Care Development Block Grant funding. When that 260 million is gone, it's gone, and it has to be spent by September of.
I understand, but
Okay.
what I'm worried about is if you're going to be asking for additional dollars for ongoing programs, which we have taken, as far as CARES money, or excuse me, as far as the ARPA money is concerned in other locations within the state government, we're not looking at expanding programs.
Right.
So, you know, I don't want to be sitting here in next year looking at budget time.
Sure.
And you all come forward and say, okay, we got a $54 million hole and you need to fill it with state dollars. That ain't going to happen. So I just wanted to warn you, that just isn't going to happen.
Right, we understand exactly what you're saying.
Okay. Okay, that's all I have. Thank you, Mr. Chairman.
And Delegate Fleischauer.
Thank you, Mr. Chair. I had, thank you. I had a question about the number of, on our page 3, the child care subsidy, it says there are 16,777 children served. And then when you go to the, I think it was the block grant, it was another number in the 20,000 range.
The 21,000 is our annual aggregate number. The 16,777 is a monthly number. So,
Okay.
so those
So
numbers
it's
kind of
really
turn
the
over.
same number of children, or the
Yes.
same children, okay.
Yes.
And then to follow up what the gentleman was asking about when the money runs out, let me put that another way. What things will we no longer be able to do without that funding? And I'm thinking of the increase in the tier rate. Will that mean less money that would be available to child care centers to improve quality?
At this point, we do anticipate being able to increase those maintained rates. What the loss
You
of
maintain those increased
yes,
rates,
those,
right?
yes, those rates. We do anticipate, however, we are currently paying for over-income essential workers. And under the regular amount of funding that we get, we're not allowed to serve that population. So that would be where we'll see a shift.
So the child care workers have been defined as essential workers, correct?
Yes, childcare workers. There's a pretty
Oh.
broad definition of essential workers in the state of West Virginia. So that includes not only the childcare workers, but also includes like medical workers, sanitation workers. Who else am I leaving off the list? Yes, it
All
was pretty
hospital
broad.
employees
Yes,
that
yes.
have been considered. So those subsidies that helped Ruby Hospital right next door and aside, and the child care providers. And what was the third category you said?
Sanitation workers, anybody who had to do with public health kind of items.
Public health. So those, the way we buttressed those services, that will be yanked away in all probability, unless there's additional state
Right,
aid.
correct.
And, okay, thank you. Thank you, Mr. Chair.
I'm going to jump in with one question here real quick. And you alluded to it briefly, but do we have any data about how many working families or workers depend on these services in order to be able to go to work and to maintain their employment? And then do we have any data about we hear about childcare deserts? Do we have any data on how many people are kept out of the workforce because they're in one of these childcare deserts or they don't have access to childcare?
We charge our childcare resource and referral agencies with a needs assessment in their counties. But as far as like looking at the workforce, are you unable to go to work because you can't obtain childcare? They're not charged with that particular data item, so.
So the answer is we don't really know.
Right.
Okay. Delegate Zukov.
Thank you. Thanks for being here. I'm curious, of those essential workers, how many of those families are we subsidizing now?
We have about 5,100 over-income essential workers right now.
Okay. And do you know if they're in specific areas of the state, or is that just statewide? Do we have
That's statewide.
pockets? Do we have pockets that are
I'm
utilizing
sure
more?
we do, probably. I know that we have a lot in Cabell County area. And I'm also sure that in this Morgantown region, we have a large number of essential workers.
Right. And are we doing any planning for making those families aware, every
Yes.
month that these funds are going to be going away?
That is one of my absolute concerns. And see, she's laughing because I'm like, we
Yes,
need to
we
let
are.
them know as soon as possible of a potential end date for these funds so that they can plan. Because I'm sure we have some people like just over the income limit that this is going to be a big hit for. So I do want them to have time to plan their family budgets and adjust to the loss of the assistance.
Okay, thank you. One last question. When was the last time the poverty index was looked at?
It was looked at in 2021, but because right now the way the essential workers are defined in West Virginia, almost everyone's essential. So that means you're eligible. So we haven't adjusted that, but we will be adjusting that as we know that the program is going to end. So.
Okay, thank you.
Thank you, Mr. Chairman, and thank you all for being here. This kind of piggybacks actually on the chairman's question. How much interrelationship do you have with the Workforce West Virginia or the DHHR referral agency or the DHHR agency within your referral areas about collecting workforce data, about how many people are kept out of the workforce because they can't find childcare? Maybe they're on unemployment and they're using, the childcare as a reason why they can't seek unemployment. Is there any data points for that?
We don't. Some of our R&R agencies do have outreach offices that are co-located with workforce so that they're there to interact with the participants. But as far as collecting that data, we don't have that.
I think it would be nice to have that data, and that may be something we'd want to consider, because if we don't have numbers, we can't really make an accurate assessment of what's going on within the system. Thank you.
Thank you, Mr. Chairman. Two questions. One, two questions. One, I'm interested in the forums that you're having where you're discussing the different regulations, and I would love to hear back later what you hear about that. And I'm assuming then you would bring that to us during your review of your rules or whatever. But in addition to that, can you kind of walk us through what it takes to start up a center? And we've been told in West Virginia that our regulations are minimal compared to some other states. Do you find that that's true? And how long would it take to set something up, going through all the hoops that you have to go through?
Well, once we have a complete application, the HHR staff have 60 days to make a determination. But what happens before we have a complete application is, depending upon the child care provider type, a child care provider, for example, let's walk through the child care center application. A child care center application includes the requirement for the space to be inspected by the fire marshal and the health department. It requires information, documentation about the layout and the size of the classrooms that are going to be used, because there is a 35 square foot minimum per child space inside, and or maximum, I'm sorry, space inside, 75 square feet outside. So a lot of that initial work that happens is not included in that 60 days. And the fire marshal and the health department are very responsive in getting in there and getting the inspections that they need to get done. But there's also background checks that need to occur. So child care providers have to sign up with West Virginia Cares. So there's a series of activities that need to occur, and that, depending upon how quickly it can get done, I've seen it done within a 30-day period, but I've also seen it take as long as 90 days because of the spot that the child care provider wanted to use, and they had to negotiate with the landlord. But once we get that complete application, we have 60 days to make that determination. So it's a little bit on the child care providers end as to how quickly they're able to do a few of the things they need to get done.
And I would say, if you wanted to open a family childcare home, we do at our agencies have a position called a provider support specialist, and they will walk that individual through every step of the process. They'll hold their hand through getting through West Virginia Cares. We have a health and safety startup grant, so if they need a fire extinguisher or something to meet a regulation, they can provide that support to that person.
And one last thing on that. So if you're doing a family in a home, you don't necessarily have to have the early education aspects, do you? But if you're having a child care center, then you're going through all these inspections and making sure everything's healthy, but then you have an education aspect that you have to attain as well, correct? If you're going to be providing early education as well.
If you're a child care center, depending upon the size, you might have to have an associate degree. If you're a larger program, it might have to have a bachelor's degree or specialized training. There's 3 or 4 avenues that a director at a child care center can go.
But that would still be in this 60-day time frame?
Yes.
Okay. All right. Thank you.
Senator Gefford. Nope, tap it again.
A number of our child care facilities are in churches. And we've heard some conversation that there is some move to eliminate things like Al-Anon or Alcoholic Anonymous from being in the same building as the daycare centers, even if the daycare centers are in a completely different part of the building. Have you heard any conversation about that, and does that concern you?
I haven't heard any information about that, and there's nothing that would prohibit from DHHR's side, the regulation side, from having a Al-Anon meeting or something going on within that building. There's nothing.
Thank you.
Yes.
Senator Stallings.
Thank you, Mr. Chairman. Let's look about the funding if we could. I mean, we are dependent on the 54 million federal block grant for this.
Yes.
Does the state have any skin in the game on an ongoing basis looking back, or is this just federal money?
There's a required state match in order to get the CCDF funding, and that's about $6 million that's required.
State spending $6 million a year pre-pandemic and getting to use 54. Now, with the pandemic, again, with the CARES Act, the CCRRS, and the ARPA funding, it's neighborhood of about $341 extra million in addition to the 54 million. Of course, that's spread out, I guess, over the course of the pandemic, which gets longer and longer, obviously, but it has to be spent by September 2023. What type of accounting is there with regard to this funding, this extra funding?
Well, we might have to get back to you with specifics about that, but I know that our financial department has specific checks and balances in place, reporting in place, all of that, to be able to talk more in depth about how. But
it's mostly grant funded, right? I mean, this extra money is.
You're talking about how it's going out to child care providers.
Yeah.
Yes, the majority of it, well, I shouldn't say that. A lot of it is grant funding, but a lot of it also are those subsidy supports, that essential payment. There are large chunks going that way as well. So it's kind of a little bit everywhere.
So pre-pandemic, for our just for our subsidy, we used to spend about 4.5 million a month. During the pandemic, with our expanded care for essentials, we're spending about 11 million a month, and that all happens through the state auditor's office. And there's required federal reporting and accounting for that money as well.
And again, the pre-pandemic numbers of children served versus during the pandemic. Can you compare those numbers?
Yes, we used to, pre-pandemic, historically, we monthly supported about 11,000 children. And like I said, February, we're serving the number that you see on slide 4, the 16,777 children.
And so with regard to this extra federal funding, is there any way creatively that we could somehow, I know we have to spend the ARPA money and all that stuff, but that we could make the system more robust or something as we go forward in the form of, I don't know, technology or training or anything? Because I just hate to see, when we go from what appears to be 341 million plus 54 million down to 54 million, it's going to be a dramatic change.
Yes.
And again, we were paying minimum wage before without any type of health care or retirement or anything like that. I just wonder if there's any way in the world we could somehow use this in such a way going forward that it wouldn't, because childcare is so important. It's so important for our workforce. And I just didn't know if that could happen. Any comments?
Let us get back to you, because we'll think about that and we'll get back to you. I don't have any off the cuff great ideas for you. I'm sorry.
Thank you, Mr. Chair.
Delegate Pack.
Thank you, Chairman. Thanks so much for being here today. Do you believe that West Virginians don't have adequate access to child care? Or should there be more capacity in West Virginia, more opportunities?
I agree that there needs to be more capacity. There are areas that are more heavily populated with child care providers than others. We have to look a little bit, though, at demographics and the need for a child care provider to remain financially viable. They can open their doors, but if they only are caring for one child, they're not going to be able to keep those doors open. So there's a lot of things that kind of go in to opening a private business like a child care business and staying viable while also providing services. It's more detrimental to a child to open their doors and a child go there for three months and then they close their doors and they have to go somewhere else. So there's a lot that goes into it, but yes, we do need to increase our capacity of child care slots within West Virginia.
And so, how can the legislature help that? What is it that we can do to help you or to help child care providers expand their capacity in West Virginia?
When I think about expanding capacity in West Virginia, I think about what is really coming around now with those public-private partnerships. Right now, DHHR, Workforce West Virginia, the Small Business Development Corporation is working with Nucor that is coming in to help them determine what's available in West Virginia and how child care can be supported by Nucor and how Nucor can support child care. So we're looking at those public-private partnerships. There are apparently, from what I've been told from Workforce West Virginia, not Workforce West Virginia, the Small Business Development Corporation representative, that there are private businesses that are interested in paying for slots, those type of things. So I think that will help expand if we can get more businesses in West Virginia to really understand and appreciate. And I think they saw that during the pandemic, the impact that the lack of childcare has on their workforce. So I think that will help. Yes.
Thank you.
Delegate Walker.
Thank you, Mr. Chairman. Thank you for being here. I have a couple of questions. When we talk about the complaint investigations, who are lodging those complaints? Is it the consumer or is it the providers?
Well, it can come from anywhere. It can be a community member. It can be a parent. It can be a caregiver in a child care program. It can come from anybody, but those, we have not a hotline, but an email address. They can call, they can write. There's lots of ways to lodge a complaint.
So we've spoken a lot about providers being able to apply for these grants. How many of these providers have been denied because of an investigation of the pandemic grants? Because I'm dealing with one right now here in Morgantown.
That have been denied because of a complaint?
Yes, because something happened, and so now they're not getting that extra funding and may have to close that child care center, and we need them to stay open, but they can't afford it, especially we're still in the pandemic.
I would have to talk to you a little bit privately about that program, but there's more that goes into it than the provider signs a provider agreement that they are going to maintain good standing with the regulations. They're going to be in compliance with the regulations. They're going to not disenroll a child. I'm trying to think of all the other things that are on that. But depending upon the situation, a child care provider, for example, a family child care home, is required to close their doors if there is some type of abuse or neglect situation that goes on while CPS or IIU, the Institutional Investigative Unit, looks into that allegation and determines if there's a substantiation or not.
How many forums? Have you already started the forums?
We have. There was one, I want to say it was last Monday or Tuesday. There's another one today.
So how many have you done thus far?
Just one. We have, I think, 6 total that we've got scheduled.
And where are they strategically located?
We're actually doing them online to get the best attendance we can.
Wonderful. And how many type 3 centers do we have in this state?
How many type 3? Oh, I have my information over there. We are preparing and almost have finalized a very comprehensive report with things like that in the report that we're going to send you after our meeting. We weren't sure if we were going to have to add more questions and answers to it, but right now it's about 30 pages. So there's a lot to digest, and information like that is in it as well.
Will you have a map showing exactly where those are provided in the state of West Virginia?
You would like the information about the forums? Absolutely.
Yeah.
Yes, sure.
No, about the
Where the
type 3 centers. Where are they strategically located in the state?
Where are they? Just state, and we can do that.
Oh, yes. I'm sorry.
Thank
I
you.
was not understanding. I
Thank you,
apologize.
Mr. Chair.
Delegate Pushkin.
There we go. Thank you, Mr. Chairman. Thank you for your presentation. I'm looking at the amount of the federal dollars that we've been relying on, and that the increase largely due to pandemic funding, whether it's American Rescue Plan or before that, the CARES Act. At some point, when that expires, how reliant are we going to be on a new reconciliation package?
Very.
Very? So what would it mean to the state if it doesn't pass?
Right now,
What would we have to do if it doesn't pass?
we're operating under a continuing resolution for our federal funding.
Mhm.
There is a new proposal that I just saw come through last week that would increase our federal funding by hopefully about $8 million. So that will be very helpful to us. Some of the things that we're doing, like the monthly payments to the providers, we wouldn't be able to continue that, but we do anticipate being able to keep our increased rate levels and hopefully increase our eligibility limits so we can serve a few more families. But we'll see what happens on the federal level with that.
So God forbid it doesn't pass, the state would have to, we would have to greatly increase that if we were to keep those programs, correct?
Yes.
All right, thank you.
Okay. I've got one last question. I know you talked about it takes 13 days, I believe. Explain a little bit more about the differences between monthly funding and daily funding, and then talk a little bit about the fiscal impact if we went to a monthly funding formula.
Right now, during the pandemic, we are paying based on enrollment. So we're currently covering that with our relief funds. Prior to the pandemic, if a child attended at least 13 days that month, they would receive a full month's payment. We are required federally to at least pay up to 85% of enrollment. We are a generous state, I think, in that we give 7 absent days. That's what the 13 days covers. And we do set a daily rate just because that's easy for folks to understand. So if you would attend less than those 13 days, you would have only received payment for that. Like I said, with our relief facts, we are able to pay by enrollment, just like any private pay family was who uses a child care center. You pay for the week, whether your child comes or not. So we've tried to mimic that private pay practice. Going forward, after the relief acts, if we do continue to pay by enrollment, I estimate it would cost us an additional $14.6 million per year.
Okay, so currently you are paying
Yes.
by the month.
Yes.
Okay, so 14.7 million, given the status of the current enrollment, if we continued that.
Yes.
Okay. Delegate Pack.
One last question. With respect to families that do shift work, evenings, night shift and so on, how many of the facilities child care facilities that are licensed operate on a 24-hour basis?
Centers? I don't think we have any.
We have no centers.
So that need is covered by our family child care and our family child care facilities. We do pay an enhanced rate for those who are willing to operate on weekends and evenings.
Okay, so the 24-hour would be something more in someone's home, but as far as child care centers, child care facility, they're basically working more of a day type thing. Okay, thank you.
Okay. No further questions being seen. I would like to thank you for your attendance today.
Thank you.
And your informative presentation about this vital topic. I think it's always been vital, but the pandemic has brought it more to the forefront. And I do look forward to working with you to develop some of the questions a little bit further and seek solutions to them. That being said, I look to the co-chair for the purpose of a motion.
Mr. Chairman, I move we adjourn.
Vice Chairman Woodrum moves that we adjourn. All those in favor of the gentleman's motion, please signify by saying aye. Those opposed, no. The ayes appear to have it. The ayes do have it. I declare the meeting adjourned.